The Displaced Persons Unit has 3 pillars. There's operations. Dikeledi was responsible for operations. There's programs section. I was responsible for the programs. And there's shelter management. Alan Probler is responsible for shelter management. So I've taken over from Dikeledi in terms of operational services. I'm now doing everything when it comes to the Displaced Persons Unit except the management of shelters. Okay, the Displaced Persons Unit was established in 2008, in 2009. In 2007, there was a summit that was organized by the city of Johannesburg, where all the children on the streets met, and they came up with issues and the needs of children living and working on the streets. And in 2008, the city approved a policy on children living and working on the streets. The policy is informed by the Children's Act number 38 of 2005. Then in 2010, the city approved a comprehensive policy, the policy for the assistance and management of people living and working on the streets. So our main core is to deal with people who are living and working on the street, including under the bridges, except open spaces, because that's a bylaw section. So we're not doing any bylaws, and we're restricted to do statutory work. That's not our competency. Okay, the unit. In the unit, we only have 4 social workers for the whole city of Johannesburg. We've got 130 wards. We only have 4 social workers. And for now, we rely on the interns that we have. We've got about 14 interns and 1 child care officer. So for region A, C, and B, Gibonyi is responsible for this region. These are our key roles of intervention. We identify areas in communities where these displaced people are, and then we identify the hotspots, and the social workers and the team, they go out to intake the people and they assess them in terms of identifying the relevant intervention strategies that may be used to assist them. Right now, okay, I've taken over from Dikeledi in terms of operation from September, and we came up with a way of monitoring the effectiveness of the assessment center, the governor's house. So we have daily walk-ins. In a week, we see more than 100 people who come through the assessment center. They come for bathing, they come for social work services, they come for assistance in terms of family reunification and placement. They come for a career placement, or just to inquire about services that are being rendered by the DPU sections. So this is what we do. And we also do outreach programs, like we do preventative programs, early intervention, family preservation, rehabilitation, support programs as per the legislation, the Children's Act legislation, because there are things that we're supposed to be doing, but which we cannot do without the provincial health and social development's approval or devolving of those services. Obviously, it's supposed to come with funding, so we still have that gap. Like for instance, if you meet or you get a call that there are women who are using babies at an intersection, we go there, we educate them about the bylaws and about the services or opportunities that are available. When they keep on contravening the bylaws or the laws of the country, we rely on SAPS for intervention. But in most cases, when we take these people to SAPS, there's still this gap. I know it has just been restored, the Child Protection Unit has just been restored, but there are gaps because police stations operate differently. You go to this police station, they're not willing to assist because they don't know what procedures to follow, and some think that this person didn't commit a crime. But fortunately, last week we established something like a network set up with a Johannesburg Child Welfare, SAPS, and other stakeholders, including hospitals, where we felt that we need to come together on a quarterly basis, and our next meeting is on the 17th of February, where we will be able to iron out these gaps. Like, for instance, there's a lady, Captain Joyce Buthelezi, who is responsible for the Child Care Protection Unit, and she committed to encourage her superiors to come up with a policy or standard operation procedure so that everybody can be on board and understand how to deal with these people, because this is the deliberate child neglect and deliberate child abuse. The problems, the people that we feel can be involved in addressing the problems are all these stakeholders that I mentioned here. We've got internal departments and external departments. And we hope this type of networking will assist in us coming up with an intervention, not only just solution, but we feel that if everybody can get involved, we'll be able to address the problem. Because the problem of displaced people has become complex. In the past, you would find people just begging and sleeping under bridges or wherever. But now it has become too complicated. You'll see when I present the common activities that we come across. This is the integrated approach that I'm appealing for, and everybody else, Mary has spoken about it, Councillor, everybody who's around here is talking about us dealing with this issue. The the common activities that we come across is begging, street begging, which is by law has got to do with by law enforcement and law enforcement, because there's abuse of children. Then alcohol and substance abuse. We come across criminal activities, people breaking car windows and smash and grabs, things like that. We come across commercial sex work. In all the regions, it seems one problem. At times it's not happening on the streets, but at bad buildings, and they're seen everywhere. We come up with people littering, throwing everything, dumping wherever they're not supposed to be dumping. The recycling problem, where they would place their things wherever. When you go through M1 South, you'll find them putting plastic bags and all the containers. They don't care whether that place should be, how visible is the place where they can put all these things. So that is why we say it needs a common approach. Some urinate in public, they sleep in wherever they want to sleep. Then these are the types of possible multi-sectoral interventions. We've started with it's Ward 90, Ward 104, Ward 87. We've started with Region B, we've started with Region A and E, with Region G and Region F. So we want to find out how big is the problem, because if we want to come up with a sustainable solution, we need to understand the extent of the problem and where does it emanate from. The common cause of the problem is poverty, abuse at home, family disorganization, unemployment. You'll find that a person went to look for work and he found the job that he was looking for, but he forgot about the family. Once he loses his job, so he doesn't have that courage of going back to face the family. So there are a number of problems. So whatever solution that we have to we're going to come up with, we must look at all the causes and come up with relevant solutions. What we're saying here, we feel that we need to encourage the community at large, especially children, to volunteer their services or our services, or if we have resources, to avail the resources so that we can be able to make a difference. In the past 2 months, I had an opportunity in one of the network meetings. I met a Danish president of Association of Films from Denmark. What she said was very encouraging, that in Denmark is a small country. It has a population of about 50,000 people. And then a person starts paying tax just a few months after birth. And everybody, children are taught from school that you have to do voluntary work. And everybody does voluntary work. After completion of education, you do something. And if you refuse to do that, you just get ostracized. So that is why it's so flourishing. So if we can instill that to everyone, that let's do our part. If you have a social work background, on Saturday do something somewhere, then we will be able to assist in address or in making a difference for the country. The programs that we are doing in DPU, we have in-house services, intake assessments and referrals. Then we do outreach services, prevention programs, early intervention, family preservation support programs. Then we have 3 sanctuaries. These sanctuaries are managed by Alan Kropler. The Women's Sanctuary is in Terfontein. It caters for children from 8 years to under 18. From 7 years to under 18. Then we've got Hospital Hill for adults, and we've got the recently opened the 3 Street night shelter, just opposite Constitutional Hill. So these are our contact details. For hotline, if there is an emergency or one sees people on the streets, they call this number and our teams respond as per their regions. And these are our contact details. Mine is 082-785-5947. For Mr. Krovler is 082-467-9578. And the social worker for this region is Kibunye Silna. At the moment, she's being assisted by the 3 interns that we have. And our offices are in Hillbrook, Governor's House, Konakote, and Queen Street. Thank you.
Another thing is that there is, and I'm using a Cape Town example again, there is a thing that they realized that people needed to be connected to, you had Mrs. Jones, who went to help an ex-welfare organization, and her usefulness came to an end when whatever she was required to do was now finished, and she hung around and got to be a nuisance. So they started a thing called the Welfare Volunteer Center, where it's a placement agency for volunteers, and this would be ideal because then one would actually say you need X people to do your Y date, and it also connects people up with organizations, and they didn't feel pressurized to be there every day. If Mrs. Jones could come on a Monday, Wednesday, and a Friday from 10 to 2, she came on that day and she was gainfully employed, and there were contracts, and you know, it meant it also clarified the fact that they were volunteer or are a volunteer, and there isn't any expectation for payment, and the rules are clearly defined. And I think if we can devote some attention in the handbook and the process going forward to actually having some kind of volunteer centre, that could, your friend Primrose could very easily be involved helping people to actually connect up with resources and connecting so we can match people effectively.
Yes, I think that can be, yes. And maybe the organizations that are providing feeding schemes like soup kitchens, if they can offer maybe to come to Governor's House on certain dates, just to give them whatever that they have, because we provide them with clothes and ablution facilities.
But not food.
No, but not food, yes.